the presence of pecten pubis in the iliopubic eminence. An obturator crest or obturator notch is generally present in the obturator foramen of the acetabulum. And next, moving on to ilium. Ilium is the upper expanded bony plate of the hip bone. It consists of iliac crest, greater aortic notch, inner and outer surfaces. Iliac crest is the upper border of ilium. So this is the upper border of the ilium. Just it is present at the level of L3 and L4 vertebrae. It consists of anterior superior iliac spine and posterior superior iliac spine at the crest end. So the anterior border of the ilium extends from the anterior superior iliac spine to the acetabulum. The lowest part anteriorly named as anterior inferior iliac spine, and in the posterior part it is termed as posterior inferior iliac spine. It gives attachment to the straight head of rectus femoral muscles and iliofemoral ligament of the hip joint. So this is the rectus femoris muscles, arises from or originates from the iliac crest, that is the anterior inferior iliac spine, and attaches to the tibial tuberosity. And this is the iliofemoral ligament which binds the ilium and femoral joint. So the greatest aortic notch, it is the curved notch below the posterior border of ilium. So this notch is converted into greatest aortic notch or greatest aortic foramen by two ligaments named as sacrotuberous and sacrospinous ligament. This foramen transmits sciatic nerves and vessels to the lower limb. So this is an image which picturizes the greater aortic notch and the lesser aortic notch, where it gets transformed into foramen by the presence of these two ligaments, that is sacrotuberous and sacrospinous ligament. It has two surfaces, inner surface and outer surface. Inner surface has iliac fossa in front and sacropelvic surface behind. So iliac fossa provides attachment to the iliacus muscle. In the presence of right iliac fossa, it consists of appendix, and sigmoid colon is present in the left iliac fossas. Sacropelvic surface is like the ear-shaped surface behind the iliac fossa, which provides attachment to the sacroiliac joint. The outer surface provides attachment to the gluteus maximus, minimus and medius muscles. So the outer border is picturized in this picture. Ischium. It forms the posterior inferior part of the hip bone. It consists of body and ramus, and it has an ischial spine and ischial tuberosity. Ischial tuberosity, the lower end of body forms ischial tuberosity. The upper end of ischial tuberosity provides origin to the semimembranous on the lateral side and semitendinous with long head of biceps femoris muscle on its medial side. The lowest part provides origin to the adductor magnus muscle, and this picture shows the insertion or origination of adductor magnus muscle from the ischial tuberosity, and this picture shows the presence of semitendinous, biceps and semimembranous muscles origination from the ischium bone. Ischial spine. The posterior border of ischium provides a spine-like projection called ischial spine. Above the ischial spine, it is called as greater aortic notch, and below it is termed as lesser aortic notch. Ramus of ischium. It arises from the lower part of the body and joins of the inferior ramus of pubis. Acetabulum. It is a cup-shaped cavity on the lateral part of the hip bone. It's a deficient lower part called as acetabular notch. It articulates with the head of femur. Obturator foramen. It is a large gap in the hip bone. This foramen is enclosed by the obturator membrane. Thank you.